Carlos Rosales, he of course grew up in Mexico City, first 10 years of his life, undergraduate at Baylor, obviously medical school, and has been here in Pittsburgh close to a decade. He's a vascular surgeon. We're talking about the carotid artery. So how do you detect someone has a disease, Doc, and they need help?
Well, it's multifactorial. There's physical exam, obviously, and history. History is key, particularly what we do for a living. Our patients, they're almost always carbon copy, smoking, being the big, risk factor. Is very rare that I see somebody without smoking. Unfortunately, there's genetics as well. Sometimes, you can't get rid of your genetics, and diabetes. So whenever you have those problems, that immediately leads to usually start with your family doctor, maybe doing some screening tests for all these things, and eventually ending up in my office, where I may order some other tests, to try to see what the problem is and how bad the problem might be, along with the symptoms the patient is having, so you can decide what to do.
So your suggestion to someone, say 50 and over, be trustworthy and honest with your physician. When they ask you if you smoke, tell them you smoke. And if you are getting regular checkups, this is something you should consider getting checked, your carotid artery.
Absolutely. If you have the risk factors, there's no reason to lie. Otherwise, it's hard for us to order the right test. So if you are a smoker, you should definitely disclose that to your physician. And then screening, right? If you don't screen, it's very difficult to pick up, some of these exams. If you have the risk factors, most of these screening tests are non-invasive, and it can be very helpful to diagnose you early and hopefully pick up problems prior to them causing a major life-changing event.
Call in for the second half hour right after CBS Radio News with Dr. Piper, your host, at 866-391-1020. Dollar Bank Instant Access, KDKRadio.com, and you can text us on the Right Automotive line, the best deal in town. Good evening.